That's it.
All right. And my name is Mark Watanabe, and I'm going to be doing my focused assessment. So the first thing that I'm going to do is I'm going to check my physician orders. I'm going to gather my supplies. Then I'm going to wash my hands and put on appropriate PPE, which I will go ahead and do. And I also let the patient see me washing my hands. And I'll just go ahead and introduce myself. My name is Mark Watanabe. I'm going to be your nurse today. Can you tell me your name, please?
Tommy Willie,
All right, Tommy, what's your birthday?
9584.
Okay. And these questions are a little redundant, but where are you at right now?
I'm in the doctor's office.
Okay, and what day is it?
Wednesday.
Okay, awesome. And so now that I've introduced myself, can I also check your armband just to make sure? All right, awesome. So what I'm going to be doing today, Tommy, I'm going to close the door, give us some privacy. We're just going to be doing a focused assessment and just a general assessment as well. From what I understand, you're here for abdominal pain.
Yeah,
correct?
some
Okay.
stomach pain, yep.
Are you having pain anywhere else?
No.
Okay, awesome. So we'll just go ahead and do that assessment. So I'm going to go ahead and raise our bed. I'm going to lower these guardrails real quick. And the first thing I'm going to do is I'm going to just start by checking your pupils. And I'm going to put this right here. And I'm just making sure that your pupils are round, reactive, and that they accommodate consensually, which they do. Next, I'm going to check your nostrils, or your mucous membranes, making sure that they are intact, non-excessive secretions, no erythema. If you could open your mouth for me. I'm also going to check your mucous membranes there for the same thing. Which brings us down to pulmonary. And so I'm noticing that your oxygen saturation, you're at 98%. Have you had any cough recently?
No cough.
Okay, awesome. So what I'm going to do, I'm just going to listen to your lungs real quick. All right, and I'm going to be listening to 5 different spots on here. Just take a deep breath, or pretty normal actually. Okay. Next, I'm just going to be listening to your heart. And so I'm going to just start by listening at the top, aortic, pulmonic, come down to Erb's point, to tricuspid, to mitral. All right. And then from here, I'm going to move down and go to check out your abdomen. So I'm going to inspect it first. And right now, I would have you raise it, but I'm just looking for things like striae, scarring, if there's a hernia, ecchymosis, any type of lesions on the abdomen, which there aren't. So after inspection, I'm going to move to auscultation. And I'm just going to listen in 4 quadrants, starting in the right lower quadrant, listening for normal bowel sounds. If I didn't hear that, I would listen for longer, but I'm listening in a minute each, and I do it here as well. So from here, I'm going to move on to percussion. Now, which area is the spot that hurts the most, just so I can be more sensitive? Okay,
right here.
so I'm just going to percuss a little bit. I won't go too hard, and then I'll be more careful once I start with the actual palpation. Okay, and for this, I'm just listening for tympany, making sure that if there was any dullness, that could be a sign of just an enlarged organ, but we're good. So next I'm going to move to palpation. I'm going to start with light touch, okay? And then you just let me know if it gets too much, and then I'm going to switch actually to go a little bit deeper, okay?
That's a little tender.
Right there, okay? Hurt more when I let go?
No.
Okay.
Yes, no.
All right, noted. All right, so I'm just going to check each one. Okay, just let me get down here. There we go. And down here. Starting down there. Got myself lost there for a second. All right. Okay. And Tommy, when was your last bowel movement?
This morning.
Okay. Do you have a catheter in?
Nope.
Awesome. Fantastic. So now I'm going to switch to assessing your arms. You don't have an IV in. I'm just going to check for tuger, no tenting. Okay. I'm going to check your brachial pulse, your radial pulse. Okay, those are good. I'm going to make sure that you have capillary refill, which you do. And then if you could put your arms out like this, put them like this. Okay, push out. All right, pull in. Okay, and I would do that bilaterally. So we've checked your arms. We're going to move your legs. We check. We can start with checking pulses. I could do the inguinal. I'm not going to do that necessarily, but then I can do popliteal pulse, dorsalis pedis, and then posterior tibialis. While I'm down here, I'm going to go ahead and just check and make sure that there is no edema, which there is not. I would also remove the shoes and make sure that the skin is intact on the heels. There aren't any wounds there. And I would also do capillary refill on the toes. But you can't remember if I did capillary refills on your fingers. So I'm going to do that just to make sure. Great, there's capillary refill. And then we're just going to do range of motion with your legs. If you could extend your right leg. Okay, bend it. Okay, now push the gas down, raise it up. Okay, now do so against resistance. Okay, now try it. Don't let me push it down. Let me pull it up. Okay, I would do that bilaterally. Awesome. So now that we've done the legs, we can move to the back. I'm just going to have you lean forward. And I'm just looking at the skin right here, making sure that everything is intact. Now I'm going to go ahead and listen to your lungs, to 9 points right here. I'll just take deep breaths. 1, 2, 2, 3, 4, 8, 9. Okay. You can see. Perfect. Sit back. And so with that, I can now move to general skin assessment. We already verified that you didn't have any pain anywhere else. And with skin, I'm just making sure that he doesn't have any other injuries, any lesions, scarring. Correct. His temperature to the touch, when I touched to the back of the hand, was good. And also when we checked it, that was good as well. And do you have any other ports?
No.
Okay, no, patient has. Patient does not have any ports. Good. And I cannot think of anything else right now. So I think we're good for now. So thank you for your time.
You're welcome.
So I'm going to go through my post procedures. I would lower the bed. I would raise the handrails. Give you your nurse call button. Do you need anything before I step out, Tommy?
Nope.
Okay, hey, well, thank you so much for your time. I should be back in the next 20 minutes. So I can now take off my PPE. I can clean my supplies, do hand hygiene, and then I would document name, date, the procedure that was done, and how the person responded. So thank you so much, Tommy.